Mid-March, Illinois became one of the first US states to issue a stay-at-home order. The drastic action was taken in an attempt to curb the spread of COVID-19.
I fully recognize that in some cases, I am choosing between saving people's lives and saving people's livelihoods. But ultimately, you can't have a livelihood if you don't have your life.
As the city's streets fell eerily silent, medical staff found themselves on the front line of fighting a global pandemic. Although the virus does not discriminate, it didn't take long for authorities to notice that the city's African American and Latino communities were being impacted more deeply.
We're all in this crisis together, but we are not experiencing this crisis in the same way.
Statistics suggested black Chicagoans were dying at a rate nearly 6 times greater than white residents. And at the heart of the crisis, a small safety net hospital, providing care to low-income, uninsured and vulnerable populations. For years, the hospital has suffered from a lack of investment.
It's ruining our hospital. And when I say we're outgunned, outmanned, and underfunded, there's absolute truth to that statement.
The Roseland Community Hospital is situated on 111th Street on Chicago's far south side. It was built almost 100 years ago. Over time, as the Great Northward Migration took place, the Chicago area became predominantly African American. Disinvestment followed, industry declined, property values crashed. For years, the area has suffered from crippling high unemployment and crime.
We live in a war zone. And it's so sad that we had to teach our children how to fall down and stay down when you hear gunshots.
Joyce Chapman is one of the community leaders.
The growth of economic development is gone. You know, on the strip from Michigan Avenue coming this way, it has been in a decline. A lot of got to do with the employment opportunities for our residents here in this community.
Much of the area can be classed as a food desert, defined as an area where at least 33% of residents live at least a mile away from a grocery store or shop that sells fresh fruits, vegetables, or other foods considered healthy.
We didn't have access to fresh produce in the community. We had to go and travel outside the community. A lot of the stores closed in the community, and the stores that were in the community, sometimes they're selling expired produce. Which causes a problem. So the community did not have access to fresh produce.
Tim Egan is the CEO and president of Roseland Community Hospital. He says their asthma outreach program eliminated thousands of pediatric visits to the hospital's emergency room. But programs to promote healthier lifestyles cost money, which the hospital simply does not have.
Because there have been decades-long of divestment, especially when it comes to healthcare in the African American community, such as Roseland Community Hospital, you've had a major impact because there are so many comorbidities in the patients that we serve on a day-to-day basis. Doctors will say comorbidities, and I'm an administrator. I'm saying there's quad morbidities. We have people that are coming in with hypertension, high blood pressure, they've got asthma, they've got obesity issues.
The hospital operates on a $50 million annual budget. Under the current system, safety net hospitals administer their services and then get reimbursed by the state. But a tweak to that system means many of those reimbursements arrive late or are completely denied.
We're a Medicaid hospital. We survive by the hospital tax assessment that's been in place for decades, and over 2 decades actually. And that assessment was always set up as a Robin Hood tax. Every hospital pays into that fund, then the federal government matches that fund, and then those funds are redistributed to high Medicaid hospitals like Roseland. Then 2 years ago, that assessment was redesigned. It went from a Robin Hood tax to a Sheriff of Nottingham tax.
Against that backdrop of a food desert, a population with a high number of underlying health conditions, a 20% unemployment rate, and a hospital fighting to stay in operation, the US became the epicenter of the COVID-19 pandemic. Drive-through testing facilities were set up at various locations in Chicago. Anticipating that hospitals would be overrun, Chicago's huge conference facility, McCormack Place, was turned into an emergency medical facility. Rosalind was quickly swamped with patients.
We had to have multiple times where we had to come in and decompress the ER because the capacity was met. We had run out of beds on the floor. ICU was full to capacity. A lot of patients on the ventilator, and patients coming in with a tremendous amount of respiratory complaints that required immediate intervention and hospitalization.
In March, with testing still limited in the area, doctors at the hospital had to work around the issue.
I think the biggest difficulty was in identifying which patients have the COVID, because the testing was so scarce in the beginning. And I think that's the most alarming thing for anybody, is not knowing, because a person doesn't come in walking to the ER saying, hey, I have the corona. You know, there's ways to go around without any type of testing, looking at the chest x-rays, the CT scans showing, you know, similar and identical pneumonia. You know that, hey, this is probably COVID.
Tighten it up, tighten it up.
Not knowing what they were dealing with, the hospital set up their own in-house testing facility. The hospital would allow anyone who wanted a test to get one, regardless of whether they were showing symptoms or not, or whether the hospital would be reimbursed.
So the cars need to go first.
Cars need to go first?
Yes.
Okay. Make sure their phone numbers, make sure their email is right.
It haven't stopped every day. It haven't bagged down at all. We just wonder, where are these people coming from?
Unlike other testing sites in Chicago, Rosalind also has a walk-in facility, an important factor in a neighborhood where many residents simply don't have cars.
My girlfriend tested positive, and I just wanted to be on the safe side. And most doctors said since I didn't show any symptoms, fever or anything, I should be okay. But just to be safe, because I'm around people and I have a family.
There's a lot of patients that come through the doors and they tell us that they went to other places that would not test them because they weren't showing signs or symptoms. And a lot of them don't show signs and symptoms, and when the results come back, they are positive. But no one would test them unless they're having the symptoms. But we don't turn them away. If you want to be treated, Rosalind is going to take care of you.
As the pandemic deepened, so too did the pressure on the hospital's resources. The hospital's 10-bed intensive care unit was quickly overwhelmed with COVID-19 patients.
I think that we probably need twice the capacity of ICU beds. We have run to capacity with ICU for the past month. So what happens, one patient is replaced for another.
Dr. Terrell Applewhite is the chairman of the hospital's COVID-19 task force.
Because we only have a 10-bed ICU, we have some patients that might remain in the emergency room overnight because we don't have the bed capacity, so they may have to remain there for 24 to 40 hours prior to being transferred to the ICU.
A COVID-19 patient on the ICU ward flatlines. A nurse tirelessly performs CPR, but minutes tick past.
Right, it's confirmed.
Any other history?
CVA, hypertension. Okay, time to analyze.
226.
226. Doc advised we want to do what we want.
200.
200 joules, stand clear.
Here. Here.
For Capri Reese, a nurse practitioner of emergency medicine, it was the 5th COVID-19 code blue that she had responded to that day.
When you have 3 people that expire on you and you've tried everything that you can and you've followed all your procedures and you've done everything that you know medicine-wise that you can do, and you still have those outcomes where the patient expires, it just really, it took a lot out of me and my team. We were running back and forth from cold blues to rapid responses. It was really, emotions were high, and it was just a really low day overall because it's like, what are we fighting here?
For Capri, the impact of the pandemic on the Roseland community is personal.
Hey, how you doing?
She was raised here.
If one gang member kills one person, the other person will retaliate. It's been several times like a bullet holes in the homes, like if you see in this home.
What is happening here in Roseland? What are the key issues here?
So there are a lot of key issues. First of all, there's a drug, pandemic of its own. If you have a mother or a family member that's addicted to drugs, they really can't take care of the kids, train them how they're supposed to be trained. You have all of these acts of violence, younger kids. I mean, we have kids 13, 14 years old that are in gangs and that are seriously dangerous, like they have guns.
So when this all started, the whole COVID-19 pandemic started, how did you feel? I mean, this was like suddenly you are now like the focal point of your neighborhood here.
When we first got our first patient, that's when, like I was telling you earlier, it became very real that this is not a virus that's affecting people overseas. It's home now, and it's becoming real, and it's actually in our community.
Were you scared at any stage?
Yeah. I got scared like a couple of days into it, just because of seeing the people that has started to affect. Because again, we serve a community where a lot of people have a lot of different comorbidities, meaning respiratory, heart issues, lung issues. It was like we saw the virus on a whole nother level, to its at its worst, the ugliest face that it could be, because our community that we serve are already have so many health issues and social economic issues in general. So people started going down fast, and it was very scary.
Among the doom and gloom, there are also the success stories. Levon Heron has been in the hospital for a month. For much of that time, he feared he wouldn't make it.
I'm just scared. I thought I was going. I seen my life flash, and I was about to give up, but I didn't give up. This COVID-19, just want to tell people though that it ain't right. It ain't good to play with this, because a lot of people just is leaving from COVID-19, and I was one of the ones that beat it.
But many, many others have been less fortunate.
It's devastating. We can't have funerals for their loved ones. They can't see them. They're leaving down to the morgue, or to a funeral home, and their loved ones don't get a chance to say goodbye.
I see the part when we have to move the morgue around in order to get the bodies that are there to make room for more to come in. So that becomes, like I said, it's just really, really depressing and heartbreaking.
Many of the medical staff have been working intense long hours, day after day.
We have staff members that have become sick and ill due to this virus. So it's actually changing, from one schedule, you might have 3 people call off. The next one you may have 4. When it's short on the floor, I've been responding to codes and rapid responses, doing nurse work and supervisor work and filling in for the CNO. So it's been a lot.
The workload is very hard by me being the only CNA up here. It's very difficult to see these patients in the shape that they're in. I just try to say, if I was in their shoes, that I would want the care, the good care, not being neglected because I have COVID-19. But it's very hard seeing them like that, and I just thank God that I'm in perfect health, that I'm able to help these people through this trying time.
The emotional and physical toll has been tremendous. In the beginning, It was 12 to 14-hour days every day. The staff members come every day. They're very committed, and they really work hard. I'm proud to work shoulder to shoulder with a lot of these people because they've shown me that if we come together as a community and staff, we can provide a lot for this community at large.
There is also the financial impact of the pandemic, the extra equipment, the PPE, staffing costs, and the testing program all come at a cost.
We'd love to have a busted slot machine that's paying off. We don't have that. We have the taxi meter that's running, just clicking off and off. We are on a thread. We're in debt. And now we're in a bigger debt because of all this investment we've had to make because of COVID-19. But I can tell you now, without the state giving us a bigger share of that assessment dollars, we're in big trouble. Here's the investment portfolio at Roseland Community Hospital. I play the damn lottery every week, praying that we can hit the jackpot so I can make an investment in this hospital.
Despite the enormous pressure on resources, Roseland is a success story. It has risen to meet the challenge, but uncertainty for its future remains.
We've got to stay with these hospitals. Once you lose a hospital, I'll tell you, it affects a neighborhood and a community and a town forever. So we've got to keep this investment to help our hospitals all the way.
Our community needs this resource. There's nothing out here on the far south that is doing the testing like this. And it's free for our community residents. So why not provide the more resources for our Roseland Hospital?
We have to seize this moment, and we have to basically turn this scenario around that's hurting our community and turn it into a positive and make sure that we demand better health care. So we're going to take this travesty and we're going to turn it into a positive.
If for one reason or another it wasn't here, what do you think the impacts would be here on this community?
It would be devastating. We are the community's hospital. We are here. So I don't even like to think about, us closing because I've been here for so many years. I've seen us overcome so many battles.
So if this hospital wasn't here, would people die?
Absolutely, without a doubt, without a doubt.
Roseland Community Hospital, our tiny little safety net hospital, has literally been the tip of the sword in this fight to flatten the curve. We've been the tip of that sword on our own with no support, with a hell of a lot of criticism, I might add. But what we've done is unprecedented. There's no playbook for COVID-19. We're writing a damn playbook. So what we are trying to do is showcase that we are a vital resource that's desperately needed in the Roseland community in the south side of Chicago.